Throughout history, humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device, and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness, and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
Good evening to our listening and viewing public, both locally and in the diaspora. Welcome to this August 30th COVID-19 press briefing. This evening, our sole presenter will be an individual who has been at the helm, championing our response efforts in the fight against COVID-19. Honorable Dr. Irvin McIntyre, the Minister responsible for Health, Wellness, and New Health Investments. His presentation will include key areas: the structures at the isolation unit in Portsmouth, COVID-19 vaccination and testing, and protocols implemented by the Ministry of Health. So to get this evening's briefing started, I would like to welcome the Honorable Minister responsible for Health, Honorable Dr. Irvin McIntyre.
Fellow Dominicans, good evening. With the ongoing COVID-19 pandemic and the recent increase in cases in the past month, it is my duty and responsibility to keep you aware of the activities taking place to reduce transmission as well as decrease and manage active cases related to this present wave. The Ministry of Health and the entire government has had to make major adjustments and implement several measures to deal with the present wave. Policy decisions had to be taken for the greater good and safety of us all. Some of the restrictive measures may not be the liking of everyone, nonetheless, it's for the benefit of everyone. We had to strike a delicate balance between our health and safety with our livelihoods. We also had to make allowances to manage the psychological well-being of our nation, including our frontline workers, who have been at the forefront day and night, and almost on all year for almost 1.5 years. To cope with this increase of the new cases from the additional, from, no, that thing. To cope with this increased number of new cases, we have retrofitted additional buildings. From a logistic point of view, this was done in Portsmouth, since we have already been managing our quarantine and isolation in that area. To manage our outpatients at COVID-19 care complex required significant augmentation of our human resource to include both medical and non-medical support staff, doctors, nurses, nursing assistants, ward aides, orderlies, maintenance, domestic workers, etc. We had to set up a completely new structure of doctors. This new structure is headed by Hospital Medical Director, Dr. Adrian Deschaussee. The St. James facility, the doctors are Dr. Tora Brady, Dr. Ray Rodriguez, Dr. Kieran Newton, Dr. Jajak, and Dr. Libla. The Campus Activity Center, the doctors are Dr. Esprit, Dr. Hernandez, and Dr. Charles. Other asymptomatic facilities include Avisville Luxury, Avis Comfort, Ross University Housing, Portsmouth Beach Hotel, Barons, Regents, and these are Dr. Vin Savre, Dr. Clementine Afana, Dr. Timby Wallis, Dr. Kelichi Ofo. The nursing staff structure includes our Principal Nursing Officer, Mrs. Terilia Ravalier, Deputy Principal Nursing Officer, Administration, Magdalene Popon Alexander, Deputy Principal Nursing Officer, Clinical, Rosman Nicholas, and there are 5 Directors of Nursing, Kathleen Newton, Fiona John Hope, Kanita Bopia, Lavinia Matthew, Adora Tuse. Departmental Sisters, Janelle Collier, Teresa Andrew, and Naya Shaplis. Ward Sisters, Emily White, Donna Laura, and Karine Lavoisier. There are also registered nurses, nursing interns, community health aides, ward aides, orderlies, domestic workers, data entry clerk, drivers, housekeeping, and handymen. To support these new facilities, it became necessary to have a separate pharmacy department. This new pharmacy department will be available 24 hours to provide routine and emergency drugs to the facilities when needed, as well as to dispense medication on discharge from the facilities. This department is headed by Senior Pharmacist, Mr. Tyson Johnson. While these facilities deal with management of our COVID-19 inpatients, our efforts in the field continue. There are 2 critical activities which have been going on in the Out District even as we speak. Firstly, there's a COVID-19 outpatient program unit. This separate department became necessary since the protocols for home isolation came into effect. This unit is headed by Dr. Gilda Nesty, and the team of central unit at the district and the district level as well. This is for the patients who were asymptomatic and fully vaccinated and allowed to home isolate with a red wristband for a period of 10 days. Also, the unvaccinated patients at COVID care complex whose antigen test on day 5 is negative and discharged with a red band to complete 10 days of home isolation. This information is sent to the COVID-19 outpatient program unit for monitoring and subsequent clearing and cutting off the red band. This central unit is in close contact with the district healthcare workers. All patients discharged to home quarantine are given telephone numbers of their district healthcare providers. These district healthcare workers are at your service 24/7 if the need arises or just clarification on a matter. The discharged are also given a list of do's and don'ts when on home isolation, for example. They should not allow anyone to visit their homes. They should not allow sharing and mixing of persons. They should also not allow the using of the same utensils. They should also not allow sharing of the clothes and also recording their temperature at least twice a day. This information on those on home isolation is also sent to the police in the district in order to help with the surveillance and monitoring of these patients. And of course, the public must play its part in notifying the police or the healthcare workers of anyone who may or may not be complying to the home isolation measures. The second field activity, which we are all aware of, is antigen testing. We have been carrying out an extensive island-wide testing of health centers. Zonal centers, for example, the stadium and the Larry Resource Center. Also community halls, resource centers, in some cases even school buildings, as we did in Penville and Bells. There's also the Old Mill Cultural Center, which has been used, and even at the workplace of some corporate entities. We also have 2 mobile teams who have been to various villages, returning home late at night, which some of us must have witnessed. The main objective being early identification of cases and immediate removal of isolation. By this, we can limit the interaction with the public and decrease transmission. This activity has aided us tremendously in our fight against this wave, and the public participation is commendable. I'm also requesting the public to continue turning up for testing in all our testing sites. You must know your status. Doctors, nurses, community health aides, drivers, and support staff have really stood out, and we are very grateful for your dedication, effort, and contribution in the fight against COVID-19. Another very important measure in the fight against COVID-19 is vaccination. This has become even more relevant in light of the fact that we finally received confirmation from CAFA that we do have the Delta variant in Dominica. All our samples sent to CAFA, which was subsequently sent to the University of the West Indies for sequencing, returned positive for the Delta variant. This particular variant rarely has no cough and fever. Rather, joint pain, headache, neck and upper back pain, general weakness, loss of appetite, and pneumonia. The Delta variant is also more virulent and takes less time to become extreme, leading to a higher death rate. This is because the Delta variant does not remain in the nasal cavity for a long period of time, but quickly settles down to the lungs, leading to pneumonia, and in some cases, eventually leading to death. Having said this, it is of paramount importance that we all must participate in the vaccination relaunch and rollout of the Pfizer vaccine. This program will be headed by Dr. Kivian Burnett, with assistance from EPI manager, Nurse Florestin Luth, with a team of dedicated logistical, health, educators, and data entry clerk personnel. We have had numerous consultations with the Ministry of Education, since Pfizer vaccine will be available to persons within the age group of 12 to 17 years as well. We are developing new strategies to get to the target population, to include the corporate sector, public service, schools, and the wider community. We have on island enough vaccine doses to achieve herd immunity. Sinopharm, 13,943, AstraZeneca, 10,000, and soon to come Pfizer, 46,800. Vaccination is not only a Ministry of Health or government activity. The government has made vaccines available at no cost to the people of this country. We have to be responsible for ourselves. We not only decrease transmission, but we protect the vulnerable and elderly at home. We have seen that the unvaccinated are most at risk of death, and we must take heed. Vaccination must also be seen as the action which you and I can take to ensure economic activity and protect our livelihoods. And though it is not mandatory, you have to be responsible and make yourselves available. You are doing it not only for yourselves, but your family and friends, the vulnerable, your livelihoods, and country by extension. At present, we are vaccinating at all type-free health centers and also at the Esprit Murphy Health Center in Maho and the Imelda James Health Center in Westlead, and these are done daily. Tomorrow, Tuesday, Saint-Sauvé Health Center, and on Wednesday, we'll be in the Salibia Health Center. In our new vaccine initiative, those of you who may have transportation problems, we'll make it happen for you. We'll be coming to your doorsteps because we know it's best for you and for our country as well. In closing, I must stress the importance of following the public health and social measures and that have been put in place. These guidelines are scientific and are proven to work. These are the very same guidelines that kept us safe in the early stages of the pandemic. Wear a mask in public. Keep your 6 feet distance from others. Avoid large gatherings. Wash your hands regularly. Practice proper respiratory etiquette. Sanitize frequently touched surfaces. I must also appeal to the businesses which are allowed to open. Please ensure that the protocols specific to your businesses are implemented and adhered to. I must also remind you that monitoring of your businesses is ongoing, and failure to comply may result in closure. To the businesses such as the bars, nightclubs, gyms, blasts, bear with us and understand the dynamics of the Delta variant, which is 2 times as contagious as the previous variant. We will continue to monitor the transmission levels and cases to arrive at a well-informed decision regarding further relaxation of restrictive measures. Let me express my deepest thanks and appreciation to those of you adhering to the protocols, participating in the testing and vaccination programs. Deepest thanks once again to all our healthcare workers. I also urge those of you who are undecided to know your status, get vaccinated. We can do it together. I thank you.
Thank you, Honorable Dr. McIntyre, for providing clarity on key areas to include the measures and protocols implemented by the Ministry of Health. As mentioned, the Delta variant is here. So we question, how do we combat this variant? How do we protect ourselves as a nation? We follow the protocols implemented, we get tested, and we get vaccinated. Remember, we all need to do our part in this fight against COVID-19. Thank you for joining us. Good evening. Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device, and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness, and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.